Tonight, we begin a week-long series looking at the opioid epidemic.
Pharmaceutical companies launched aggressive campaigns promoting powerful meds like Vicodin and OxyContin. There was movement to name pain as the fifth vital sign, and physicians began writing hundreds of millions of prescriptions based on what Madras calls poor science.
Nobody had done long-term studies on treating chronic pain with opioids. There was nothing in the literature.
You can't overstate the pressures that were put on young physicians in the late 80s and early 90s to treat pain, not just adequately, but aggressively treat pain.
Dr. Michael Dacey is the president and COO of Rhode Island's Kent Hospital. 3 ODs arrived by ambulance in the hour or so we were there, 2 more the next day. Dr. Dacey says the medical community was misled, but it shares responsibility for this deadly scourge.
You had a combination of people fervently trying to do the right thing. So you had this perfect storm coming together, and as physicians, we own a piece of this.
At immediate treatment, they will die.
We don't debate whether or not someone with chest pain would likely die if they didn't get into an emergency room. We don't debate whether a diabetic left untreated would really die of their diabetes and when. But for some reason in this sector of healthcare, sometimes there are people who want to debate those things. And the reality is the debate is over.
The number of people who die in the U.S. from drug overdoses every year is staggering.
Right before I left, the nurse or the receptionist said, "Ooh, honey, wait. I bet you're in pain. Let me have the doctor write you a prescription." And I'm like, a prescription for what? You think of addiction, you think of like a street drug and crack houses and scary places, and it's not. It's not. They're everyday people like that had no idea.
Nathan carries a clipping of a lost friend as a reminder of what could happen to him. There will likely be at least 50,000 similar obituaries this year. In Providence, Rhode Island, Rick Leventhal, Fox News.